Hello, everybody. So back we are again. It only feels well, it is only really a couple of weeks since we were here last talking about Joe and physio. And as promised at that session that we did, we were going to say that we're back here tonight to talk about COVID-19 and SystmConnect. So with me this evening, I have Dr. Stephen Comber. So he joined the practice in October 2022 now as a GP partner, and I'm sure many of you have met him. So this evening, I'm just going to start off with a little bit of housekeeping again. I thought it was quite a relevant time to just recap on what we do with live Q&A events and what to do. So before I do anything else, I have to remember to say, Helen, please can you move to the next slide? Great. So I've already introduced Steve. I don't know whether we've got time to move over Helen to let Steve have a little bit of a wave. She's giggling at me now because I've thrown her off. There we are. So that's Steve. He's on camera.
Good
there
evening.
We are. So
Good
you're
evening.
going to see him. He's going to be talking about COVID-19 in a few minutes.
Okay.
But just to come back to me. So back to me then, we're just going to carry on. So just as I've said, we've got COVID-19 to start, SystmConnect next up, and remember to ask questions as we go. So let's move on to the next slide. Just a bit of recap on housekeeping. Remember, if you ask questions, just check them and mark them as you like them rather than ask the same question again. It just really helps to make sure that we answer all your questions properly and fully this evening within the time. Yeah, and I think that's really about it. So without further ado, let's crack on to COVID-19 vaccinations, and Steve's going to tell us what we know so far.
Right, good evening, everybody. As Anna said, I'm Steve Comber. I joined the practice in about 18 months ago. I haven't been a GP partner for a long time elsewhere, so we're going to talk to you this evening a bit about the new COVID-19 vaccination that's coming up. Next slide, please, Helen. So the slides sort of aptly name what we know. So what we know is the key thing is the patient prioritization. Basically, all adults that are aged 75 or turning 75 on or before the 30th of June 2024 will be offered the booster vaccination. All patients with immunosuppression and all the guidance for patients with immunosuppression is set out in what's known as the Green Book, which all clinicians can access online. So if there are any queries about whether or not a particular individual is able to have the vaccination, we can check online with the guidelines, and there's quite clear tables on there for us to give you some guidance if there's any uncertainty around that. So if you're not sure whether you as a patient you're eligible, we can have a look and check that out for you. And also the vaccination, of course, is to be administered 91 days, 3 months after the last vaccine at the earliest. So for most individuals, that's absolutely fine, because there's a significant gap between the last booster program. There may be 1 or 2 individuals that may have had new treatment which has rendered them immunosuppressed, so they may have had one sooner than that. But we will obviously check should we come across that scenario. The vaccine they're using this time is the Spikevax Moderna for adults, and for the children 12 and onwards. We are using Comirnaty. I can't pronounce that very well. It's the Pfizer vaccine. And generally the side effects are generally the same as many vaccines, and you will probably have had similar side effects before. If you've had any with the vaccines, you tend to get certainly a heavy, painful feeling and tenderness in the arm. The localized reaction where the vaccine goes into the muscle tends to be worse around 1 or 2 times. You know, we've all had that when we've had the vaccine, when we've rolled over in bed the night of the vaccine and thought, well, hang on a minute, that hurts. That's where the vaccine's been. sometimes you can feel a bit tired, you can get a bit of a headache, and you can get the general aches or mild flu-like symptoms, and that's generally the body just starting to do the job of developing that immunity, creating those antibodies, and you get that little feeling that you get when you feel as if you've just got a bug coming on, and that's the body starting to that's the vaccine starting to work and do the job. Basically, any other type of vaccine can be given with the Spikevax. So any other live vaccine, non-live vaccine can certainly be given alongside it. So we're being encouraged to offer particularly the shingles vaccine, which the Shingrix, which is the new shingles vaccine, is actually not a live vaccine. But again, it doesn't matter if it was, it can be perfectly safe to be given in conjunction. So, all being well, if we've got the shingles vaccine and or you need an MMR booster at the time, we can certainly offer those at the same time, and we're aiming to try and achieve that for you when you come in, so you don't have to keep coming back for other jabs and things like that. So can we have the next slide, please, Helen? So we're aiming to do our vaccinations at Uphaven Surgery or Durrington, unless we've got some housebound patients. So clinics will be scheduled for Friday the 26th of April, Durrington in the morning, Uphaven in the afternoon, and then Saturday the 27th, Durrington in the morning. So we're having quite a drive on those 2 days to get a lot of people through the clinics, really. The key thing is how do you get booked in? So when the clinicians and the reception team open up the patient record, if there's any kind of contact with the surgery, we get a pop-up on the screen which will tell us that you're an eligible patient for the COVID vaccination, and we will be actually offering to book you there and then an appointment. If that hasn't happened, we will be sending out texts and things to put a link on there to book an appointment with us. And then those people that we haven't got hold of, and we can't get hold of by text message, haven't got consent or anything, we'll be popping some letters in the post to you. So plenty of opportunities to book you in before those dates. And as Anna's put on the slide here, we've got 201 patients booked so far. Got a few to go yet, but we'll get there. All right. So that's a fairly sort of quick whiz through what we're doing. Are there any particular questions?
So far, Steve, we haven't had anybody ask any questions.
Okay.
So far, I think what's been really interesting this time, which is different to what we've done previously, is that because we know we've definitely got the vaccine coming that week, we've been able to schedule the appointments and therefore just gently introduce the COVID-19 vaccine to those people who are just naturally contacting us about other things. So we've just taken the opportunity, as you've contacted us about all other parts of medical care, to be able to offer you an appointment. We will be going out to everybody else. Please don't worry about that. And we look to send the invitations out by SMS on Thursday. That's what we're aiming for. It may be earlier than that, but it won't be later than close of play on Thursday, so that you can book your appointments, and you'll have what's called a URL link in your SMS, so that you can click on that and then pick the appointment time that you want. As always, please do come within about 10 minutes of your appointment either side. And we know that we do kind of 3-minute appointments, so they are quick, but we usually get our queues because people come much later or much earlier, and then the people that turn up at the right time get, rightly so, rather irritated that they've arrived on time and then can't be seen. And it is all because people kind of do come at the wrong time of what they've booked, and it makes it really difficult to navigate that. And we could change the appointment times, we could make them longer, we could do that, but then we're using NHS resources that we don't need to when people were just to come at the time that we need them to, within about, like I said, 10 minutes either side of your appointment. Absolutely brilliant, and we can get you all through nice and quickly, and you have minimum times of waiting, as opposed to when some people come an hour and a half late and others come an hour and a half early, and you can see what happens. To come 10 o'clock, 10:30, we're absolutely inundated, and we can't manage the workload. Absolutely. So please do come at the right time.
Absolutely.
So now we do have a question, Steve.
Okay.
So is the booster eligible to anyone, no matter what age, who hasn't had a vaccine for well over a year?
A COVID vaccine.
Yes, so that's what I think. So it's from somebody that's anonymous, so I couldn't say the name. So yeah, it's about, can anybody have a booster this time?
So going back to the original slides, it's for those people that are fall into that age group or are immunocompromised, and according to the list of immunocompromised conditions, or having medications, chemotherapy, radiotherapy, those sorts of things. It's all listed in we've got the whole list of those. So if the person doesn't fall under that category and those categories, they won't be eligible for the vaccination.
Yeah, that's right. So yeah, just to be clear, it's anybody that's aged 75 currently or turning 75 before the 30th of June 2024. So are currently 74 with their birthdays before the end of June. And those are the people that will be invited based on their age, regardless of when they've had another vaccine, other than the fact that they must have a 3-month window of not having the COVID vaccine previously. So, basically since Christmas, give or take a few weeks. If you've had a vaccine since then it's likely you won't get another one in this programme. And then for those that are immunosuppressed, it's any age, at all, but they're immunosuppressed. And we know those cohorts. So together we've just got about over 1,000 patients in total, but only about 200 immunosuppressed. Everybody else is due to their age.
I've got quite a comprehensive list here, a sort of comprehensive quick summary list of those immunocompromised conditions. If that would be useful for me to quickly read that out, do you think people will want to hear that list?
You can. The only thing I would say is that it should be in your medical record already.
Yeah, and we will know about it. Yeah,
and we know, and that's why we're sending the invitations to that. So yes, by all means, call the list out. That's fine. And then if people don't get called and think they should be, then at least they can let us know.
Come to us and we can look into it. Absolutely. So the sort of list is, immune suppression due to treatment or disease. So undergoing chemotherapy, radical radiotherapy, organ or stem cell transplant, HIV, multiple myeloma, history of hematological cancer, lymphoma, leukemia, receiving immunosuppressing modulating treatments, so biological therapies, anti-TNF therapies, cytotherapies, long-term steroids, those sort of things. So those are the sort of the key immunocompromised sort of groups of patients that will be automatically called in by our system. And if there is a query, we will refer, as I mentioned earlier on, we can have a look at the Green Book, which is produced by the government, the Joint Committee for Vaccinations. We can have a look at that, and they've got a comprehensive list on there that we can refer to if we need to.
Fabulous, thank you, Steve. So while you've been talking, Kathleen has asked another question saying, why can't we have Pfizer? And I do know the answer to that one.
Okay, over to you, Anna. Yeah.
Because it comes down to supply. It's not to do that. So the Pfizer, and again, I can't really say the name either, Comirnaty, something like that, which is not how it's spelled or said, but indeed that's as close as I can get. So let's call it Pfizer, as you've said, Kathleen, to do that. So the reason why is that the Pfizer is licensed for the under 18s and there is a limited supply. So the children are having the allocated supply of Pfizer. There is not enough Pfizer to do all adults as well. There is sufficient supply of the Moderna. So the Moderna Spikevax is being used for the older adults, the 74, the adults as in 19 plus, and the Pfizer vaccine is being allocated for children because that's the only vaccine licensed for children and we have a limited supply. So that's the reason why.
Okay.
So, and then somebody else has also asked a question saying, is COVID-19 vaccine age 75 exactly or 75 and over? It is for people aged 75 and over or turning 75 before the 30th of June 2024. So that's every age above 75. okay, plus those that are currently 74 but turning 75 before the 30th of June. So yeah, and I think I've answered the questions about the Pfizer question as well. Okay, to be able to do that. So we're kind of halfway through. Have a think of anything more that you've got about kind of COVID and any questions. And while you're having a think, I'm going to talk to you about SystmConnect, because for those of you, and I'm just going to wait for Helen to kind of catch up with me. Great. For those of you that were with Joe and I when we were talking about physio, is I mentioned about SystmConnect and talked about what SystmConnect is going to be. So Helen, next slide. So SystmConnect is the online method or way that we're going to be able to, for you to kind of submit requests for medical queries, administration, that kind of thing, all about your healthcare. Okay, now you can say, well, I already do that through the website, or I can pop in, or I can do this. Basically, it's the government approach to making it a lot more efficient. And I have to say, I do absolutely agree with them. The other thing is with what's called SystmConnect is it's linking into our clinical system currently that we use called System 1. So it's a seamless kind of platform that connect the two together, and it means that you can submit queries and questions either with a medical basis or admin basis about your healthcare and what you need from us. So it will complement already how you request prescriptions, that kind of thing, how you already do that. That's not going to be removed, that's going to continue, but you're going to have an extra added kind of option of ways of making requests to the surgery without having to phone or indeed pop in. If you have access to a smartphone, or if you have access to the internet through a computer or a laptop, etc., iPad. And you'll be able to make these requests using SystmConnect from your current AirMid app. So those of you that have already got a System 1 app where you request your medications, etc., it will just automatically feed in to your app already. You'll also be able to get access through our website. So our website is currently kind of being updated, so you can click through onto the website and again get to the same questions. And coming soon is that if you use the NHS app, you will also be able to connect into your SystmConnect. So it's all going to fit in so that you can contact us online much easier. It's not live currently because we've been building it for all of you and making it as kind of as slick as we can, as efficient as we can, and also testing it with all of our team so that they feel really confident and competent to support you through this transition as well. So we've been practicing on things like Fit Notes, so that's medication, Med3s, okay, to be able to do that, otherwise known as sick notes, okay. You're also going to be able to follow up on test results, organise home visits, ask for non-NHS work to be done, and continue requesting your prescriptions, but also the queries, because we all know that it's fine to order your prescriptions when they've got a long life left of their before you need a medication review, but when they get to expiry, the computer says no. And of course, that can be really difficult because then you're left with having to phone us or come in, and that can be really frustrating. So we have a new request where you can still make those requests and we can process that beyond what you can do automatically through the prescription request systems that you're currently using. And in time, we'll look to extend more to appointments and other medical questionnaires, etc., as the system grows with us, and how collectively, that's all of you and us together, move forwards to really kind of get this kind of system underway and efficient and usable to everybody. Now, what I'm just going to do is a bit of a demo for you. So we might just have a bit of a transition whereby Helen needs to kind of turn off her screen and I need to share my screen so that I can navigate and show what you're going to see. Right, okay, so let's try this to be able to do that. So when this goes live, in effect, this is what you're going to see as the SystmConnect portal, that when you click on our website, you'll get to this point, and then you're being asked, do you want to log in to your System Online account, so that's your AirMid app, or do you want to go into your NHS login? So remember, when these are actually connected into both of these when they go live, that you wouldn't need to use our website to do that. But if you're not using an app to get in that line, you'll be going to this page here in time when our website is updated fully, which will be by next week, okay, to be able to do that. And you can pick currently from these options. In time, there will be more, okay. Now, if you click on System Online, or you click on your NHS app, what that does is pre-populate information in these questionnaires. So you don't need to keep writing your name, your date of birth, your mobile number, all of those things, because once you use an app that's got your information already in it, it will just what we call drag that information into it. However, if you go through our website, which is absolutely fine, I'll show you in a minute what's happening, is that you'll be asked those questions to put the information in each time. So we've got all of that patient identifiable information, and don't, give a fit note to the wrong patient, because that wouldn't be very useful. So once you can either log in here and it will pre-populate, or you can click one of the choices. So let's just go to fit note as an example. So when you click on any of the options, you're always going to be presented with, whoa, just check, have you got an emergency? Because this is a non-urgent service, okay? This online cannot be used to request care that you need now, okay? You've got to think, will I be all right for a couple of days? If so, great, use online. If not, probably best that you call us or pop into the surgery, okay, to be able to do that. And indeed, if it is an emergency, you've got one of these things like sign of a heart attack, please don't delay, you must phone 999. Okay, so you then have to confirm, say, no, I don't need to have any emergency care, I'm fine, and it moves into a set of questions. And what we've done at the moment is really try to explain what it is that you're requesting and give you background information, because some of us are very experienced of, let's say, requesting fit notes and what to do, but for others it's the first time. So what we really want is for people to feel confident and competent in contacting us, and what they know the plan is and what to expect. Okay, so we give a little bit of introduction here about what a fit note is, and the fact that you need to be sick for more than 7 days to get a fit note. Otherwise, you'd be what we call self certificating, because you don't need a GP note for less than 7 days absence. So once you confirm that, you just click on it. And then in here, you can write here in terms of why you think you need the fit note, whether you've been in hospital, etc., about that, to give the clinicians an idea about what it is that you have the problems for. And the more information you can give, the better, because as Steve will say, if you don't give enough, all it's going to do is delay a response from us, because we haven't got all the information. So please, don't assume that the doctor that you've spoken to or the clinician that you've spoken to is the person that's going to be doing the fit note. It is always a team effort. So please, put the effort in here, and we'll be able to respond more timely.
Yeah, absolutely.
So I just put a test in here, but you can write whatever you want, and I think you've got something like 600 characters. Then you move into the next section saying we may only issue a statement if you receive care. So you can then again refer to what it is that's happening. You click about who you've had care from. You click what you think you need, so you're not fit for work or you may be fit, because remember there's phase return to be able to do that. And if you click maybe fit, you get offered other options, whereas if you click I'm not fit, then you don't. So it's quite a clever system that we've tried to build to only ask you questions if relevant, to be able to do that. Any other information and the date of which you want the case from. That's really important that you get the dates right here, because that's the start dates that you will go from there, and how long you think you're going to be off for, to again give indication to the clinicians about what you need when to be able to do that. And then you've got the choice about how you want this fit note to be sent to you. So that's why we've said, well, do you want it just sent to a link by SMS? Because we can do that. We could send it to you by email, or you could collect it from Upavon Surgery or Durrington Surgery. So tell us what you want to do. And if you were to click by email, we'll then ask you to give consent. And I know that that sounds like you're kind of going, I asked for email, okay, why do I have to give consent again? Because obviously I wouldn't have picked it if I didn't want it, okay, I get that, but we may not have consent recorded in your record. So once you do that, that will then update your medical record. So again, to prevent any delay or mishap from the clinician's point of view, your medical record will be updated with that consent. And we just ask you to confirm your email address. Okay, so you've got that and you know what to do with it, and you've got it there, okay, to be able to put that in. And once you've got that, then you can go on to the next one. So if I just did our GP practice one, went to next and say, look, I didn't fill that out. So it's saying to me, go back and do it, Anna. Okay, and that's what it does all the way through. Okay, and when you get to the end, okay, you'll get just the submit button to be able to do that. Okay, so that's what we've got, and then you'll get notifications of those and we'll update it and we'll go from there. So just like I said from the beginning, please remember that this is not used for urgent issues. You've got to think I can go a couple of days. If you can't go a couple of days, then you've got to think about phoning us or contacting, you know, coming into the surgery, because this will be what happens. Now, it is going to be the same system for everybody. So those people that phone up and request a fit note and it's got the time, the reception team are going to be filling out this form on your behalf. Okay, there is not a shortcut. Okay, so be expected that the reception team will be asking you all of these questions, okay, to be able to do that. And that's what you've just got to remember when you're getting ready for a fit note, is what questions you're going to be asked and what you're going to be doing. And you might think, actually, it is quicker for me to do it online than to phone up and say those things, because I do have access to my app or I do have access to the internet. And we'll go through this process for everybody to be able to do that. Let me just go back. So you can see we've got different ones in terms of that. So do you remember I said about the prescriptions? What we have with the prescriptions is that you're ordering your prescriptions online, which is great. But what about if you kind of get the computer says no? Well, here we've got, again, another request of what you would like. So here is the medication that you're requesting on your regular repeat medication list. Yes. Okay. No, but I want it added, please, because I have to phone up every single month and I need it added. No, it's a one-off, or I don't know. Okay, so you can pick which one you want, and if it's yes, we ask you why you're not using your app, purely so we can learn more about it, not because we are going to in any way judge what's happening. Asking you what medications you'd like, why, etc., when you're going to run out, whether in suitable times to phone you, etc., when you're not available, should I say, and again in terms of voicemail, etc., and it goes through and you go through a series of questions. And again, if you were to call us requesting those meds, again, the reception team will be going through this protocol at the same time. So more things are going to be added to this list, as you can see here, okay, to be able to do that. But we are just starting off slowly but surely so that we can try and make sure that we get this right, because what we must not do is open up the floodgates for everything and anything to come to us, because we will fail. There's no other way to it. I hate the word fail. I don't agree with the word fail. I always think it's about learning, but quite frankly, you can contact us 24/7. All right, great. But if we are inundated, we will not be able to deal with the workload. So what we're just doing is gradually putting this in so that it is really well considered and thought about, and share your feedback with us. Okay, what was annoying? What didn't work on a questionnaire? What ask those questions so that we can properly work out what we're doing and get better and better together. Okay, to be able to do that, and the more we work together, kind of the greater, you know, speed of which we will get this launched and know more about it and make it better for us all. Because like I said, we do struggle with the telephones. people still all want to phone us at 8 o'clock in the morning. We do struggle with that, but hopefully this way means you won't have the panic about 8 o'clock in the morning for some of these things. You know that we're here, particularly when we bring in kind of the appointment requests that will come, but we just need to get this right. So Helen, can we go back to the presentation? See, Helen is busy looking around. Oh, there we are. Awesome. Great. So like I've just said, in the future, we are going to be looking at appointments as well, adding that in, which will be great. But we just want to get this right. We do not want to create problems, issues by just having very poor planning to do this. And like I said, so the appointments will be coming, and what we'll look at piloting to start with is with Joe. So again, connects into our last live Q&A with Joe and Physio. We will be asking about kind of how we can use SystmConnect to help you connect you in with Joe and the appointments that he offers. For those people that suffer from UTIs or suspect they've got a UTI, we think we can make this much more easy and efficient for you to obtain care for, and also for wounds. So we're going to try those 3 different aspects to start to see how that goes. We'll let you know as they are live, okay, so that we can keep moving that forward with you, so that you're aware of how we introduce new things rather than just leave them there and hope you stumble upon them, which seems a bit pointless to me, but you know, that can happen at times. So we'll try to make sure that that doesn't happen and we keep you updated. So really at that point, I know that it's kind of a flying tour again, but hopefully it's giving you a bit of update in terms of what we're doing and trying to make things efficient. Now, I've got a few questions to be able to do this.
Can I say a couple of things, Anna? Is
yeah,
that
absolutely.
Just from a clinician's point of view, I think the fact that it integrates so well with the clinical system, because it's designed by the guys who design the clinical system, makes it really work really well. And I think having all the information that is given to us by those questionnaires means that it's much easier for us and much quicker for us to get done what needs to be done quickly and correctly first time and in a really timely manner. So I think it will, over time. It certainly I've been sort of working with the SystmConnect requests in the last week or two, and I found them really easy to work with, and it's made things much easier for me to be able to do what I need to do to generate what I need to do for the patients. So I think you know, the questionnaires are very important, and I think if the questionnaires aren't right in any way, like Anna said a moment ago, then come back to us and we can tweak them to make them right. And we will be doing the same as clinicians. If we're not happy with them, we'll come this side of things, we'll tweak things as well. So, but I think it's definitely a really positive way forward. And you know, when I first saw this, when Anna first showed me this, I was actually quite excited about this, thinking it definitely is a really good way forward to try and allow things to be easier, and you're not hanging about on the phone, etc., waiting for people to answer, etc.
Great. Thank you, Steve. So just while we've been talking, and while Steve was talking, you could probably see me reading the questions and that have been posed. Now, there's one from a gentleman called Graham. He's said about, you know, it's another way of removing contact from the surgery. It's not meant for that. This is about giving people choice. Okay, to be able to do that and actually give the space and the time for those people that do want that face-to-face contact and do want to telephone us, for us to be able to have the capacity to do that, because those people that do want to contact us online and are not worried about that are not being forced down that channel. So it's about options. But what I wanted to make clear is that when we've launched this about, say, fit notes, be prepared for that level of questioning from the receptionist. They're not trying to be difficult when they are asking those questions that are needed on those kind of questionnaires, let's call it that, from online. It's because we are using SystmConnect to deal with all fit note requests or all medication requests, because we must have a similar system. We can't have multifaceted ways of dealing with different queries just because they've come in from different routes, because otherwise we risk patient care and patient safety because something could get lost, and that's what we don't want to do. But we are here for everybody. primary care GP world, in terms of looking after patients, is all very much a people orientated service, and there is nothing like seeing somebody face to face to work out what's happening. And indeed, people might contact us online and think that they don't need to come in and see us, and we will still be asking them to come in. So please don't think it's an avoidance. Yeah, it's an avoidance strategy. It's not. But we do want to give choice, and we want to give people the flexibility to be able to manage their healthcare in the ways that they want to do that. To look at it. The other one is Malcolm. He said that he uses System Online but have not yet updated to AirMid. Now that's interesting, because all the guidelines say about AirMid, but then when I look at the website, and like I just showed you, it says System Online. So please, Malcolm, can you just test it when we go live? Test it to see if you can get access to the questionnaires, because it's one of those things that we've been told it's AirMid, but then you know, like I said, it's in front of us. So please, if we can just test it, that would be wonderful. And somebody else has said, is System Online going to be phased out? Well, I don't really know. That's for System One, SystmConnect to get together. But like I've said, they're promoting continue with System Online on the website. So let's hope that that does work to be able to do that. And we'll see where we go with it. But while it's still working, keep going. All right, that's what I say. So we've covered all the questions on SystmConnect, but while we've been talking, a couple of others have made questions or submitted questions about COVID-19, Steve.
Okay.
So rather than me continue talking, I'm going to ask you those questions. So Steve says, I am a carer for my wife who is immunosuppressed. Can I get the COVID vaccination, please?
My understanding of the guidelines at the moment is no, unfortunately. They're not immunising carers on this round.
Yeah, so that's absolutely right. So carers themselves are not being vaccinated. They're not part of the programme, unless, of course, you are 74, turning 75 before the 30th of June, or over 75 now to be able to do that.
Yeah.
Okay, to look at. And Virginia's also said that her husband has had severe reactions, Steve, to the last 2 vaccines, and he had to go to hospital overnight. So can he refuse to have any more?
Absolutely. Yeah, absolutely. If you've had, you've had a problem with a vaccine and it's caused you a problem where you've ended up in hospital, you are absolutely well within your rights to refuse to have that. And it's always about weighing up the benefits and the risks of having these things. What we don't want is harm from the vaccine to try to prevent something else. So absolutely, you are within your right to refuse the vaccine.
Okay. So you just need to let us know so that we record your your request as a declined. Now, the declines are only temporary, so you will get invited again in winter. Okay, please don't be annoyed with that. It's just they say that people do change their mind, and if they're not asked again, you never give somebody the chance to change their mind. So it's not us being kind of difficult or annoying or anything like that. It's just trying to make sure that each time you make an informed decision based on what you want. Absolutely. And your healthcare can change. Yeah. So that's where we're up to in terms of those things. So we've overrun for a bit, but I really hope that today's session has been really helpful. You know the plan with COVID-19 now for what is phase 8, can you believe it? And you know that SystmConnect is coming, and we need to share the word about that. So you'll hear more and more from us about those things. And again, we'll look to touch base next month about what's going on with SystmConnect, and look at other programs that we've got going on in the surgery for you to meet, probably looking at our pharmacists and meeting our pharmacists on site about what's going on in pharmacy around the local area. So take care. Thank you so much for joining us. Really appreciate it. And we'll speak again soon.
Thank you very much. Good evening.